Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Nabila Vini Lamanda. So you might be wondering why the title of this video is depression. Well, I'm not a psychologist, I'm not someone who understands about mental health, and I'm not even have experience with depressions before, but I will explain a little bit of my knowledge about depression. So without further ado, let's jump into the slide. According to Wenner and Carey in 2000, so what is depression? Depression is an adjustment disorder or disturbance in short-term emotional development or behavioral problems, where in this case feeling of deep sadness and feeling of hopelessness or feeling hopeless as a reaction to a stressor with moody condition decrease. So depression is real mental illness. Those who are depressed cannot easily decide to stop feeling depressed. Unlike typical sadness or worry, depression can be exhausting and hopeless. Okay, some people think depression and sadness are the same thing. In fact, there are numbers of very basic difference between depression and sadness. So, the depression and sadness. Feeling sadness arises as a normal reaction when someone is under excessive stress. For example, when a relatives or family members has died, recently divorced, or was laid from their job. After these difficult times over, usually the sad feeling will gone by itself. And sadness actually is a part of depression, but this feeling of sadness are generally temporary. And depression is not unlike the sadness. Depression lasts in the long term. So this condition is a serious mental disorder that can threaten your physical health and your psychologist. Depression is a disease that will not get better if left untreated. So we can say that depression and sadness are two things that are interrelated, but they are still not the same. Okay, next slide. So as you can see on the slide, I presented some of the characteristics of someone who has depression, and actually there are many more characteristics or symptoms, but I was only explain the 8 most important things. First, there is no fun or joy in life. A person with depression may not enjoy the things they once loved and may feel like nothing could make them happy. Second, concentration or focus becomes more difficult. So, making any decisions, reading or watching TV can feel tiring because they can think clearly on keep up with what's going on. Third, self-respect is often absent. So people with depression may feel they are worthless or fail at everything. They may dwell on negative events and not be able to see a positive qualities in their self. Number four, sleep may be problematic. Yeah, falling asleep at night or sleeping through the night can feel nearly impossible for some people with depression. Most of them will take sleeping pills. And number five, low to non-existent energy levels. Some of them feel like they can get out of bed or feel tired all the time, even they get enough sleep. They may feel to tired to do simple daily tasks. Okay, number 6, no appetite. Some people who are depressed feel like they don't want to eat anything and have to force themselves to eat. This can to lead to weight loss, of course, for sure. And number 7, pain in several parts of the body. Some of them experience headaches, nausea, body aches, and other ailments with depression. And the last, oh, I think is the most terrifying, is had suicidal thoughts. If we see these signs in someone, then we have to stop it immediately and try to prevent them from not thinking that thoughts again. The next slide, we talk about the factors that causes depression. So there are 3 factors. First, biological factors. Second, psychosocial factors. And the last is genetic factors. So first is biological factors. Is a chemical difference in the brain can affect depression it suffers. This is related to finding differences in the conditions in the brain of people who have depression. And secondly is psychosocial factors. Certain condition that occurs in the social environment can trigger depression. These conditions such as psychoviolence, neglect, harassment, or economic condition can also trigger persons to be more vulnerable to depressive disorder. And the last is genetic factors. Depression can be inherited through genetics. For example, if one of the identical twins is depressed, the other twin has a 70% chance of experiencing depression in the future. Okay, one of the big questions that you might wonder is, can depression be cured? And can depression really be cured? So, in general, depression is not completely curable, but it is manageable and can be completely gone in a very, very long time, and there is possibility of it coming back again. So Dr. Kate Mason of the Roots Psychology Group said because depression has such a high risk of recurrence, it is very important that you seek treatment as soon as you become aware of it or when you suspect you are depressed. So it may take 2 or 10 years or worse forever to recover from depression, but we have to believe that we can fight that fear. At least we try, right? Okay, the last discussion. Okay, to be honest, actually I'm afraid to get carried away by emotions when I'm talking about the stigma of society. According to one study, as many as 75% of people with mental disorders admit to having experienced negative stigma from society. This figure seems to describe the behavior of our people who have minimal education but prioritize perception. Many people still think that mental health and disorder are taboo and should be avoided. There are many issues that are deliberately not discussed because the public's understanding and awareness of mental health is still limited to magical things that only a shaman can. They still experience depression, panic attacks, do self-cutting, and are still contemplating suicide. So depression is not just about a person level of faith, pity, and relationship to God. However, depression is more than that. Depression is a disorder that makes people think with this disorder sick. A depressed person is a sick person who should be given special care by experts and professionals. Therefore, statement of depression caused by not being close to God, lack of worship, and gratitude are wrong stigma. This stigma actually worsens the condition and feeling the depressed persons. If we can help them, then don't make things worse for them. Okay? Okay. Oh, oh yeah. In fact, the lyrics of this Lovely by Billy and Khalid song made me think about depression as a topic I was discussed. It's a nice song. The lyrics are very soulful. So you should hear it. So yeah, thank you so much for watching. Um, I'm sorry if there's a wrong word or explanation. I'm also still learning, so hope you can understand. Have a good day. Wassalamualaikum warahmatullahi wabarakatuh. Bye bye.